Hello and welcome to the COMLEX and USMLE Instant Review. Today's topic is going to focus on certain behavioral and psychological disorders in children. Let's start by talking about pica. This is a condition where patients have mental retardation and a lack of parental nurturing, which is more common in autism, patients with low socioeconomic status, and an increased risk for lead poisoning, iron deficiency, or certain parasitic infections. Patients on the board exam will present with a scenario where a child is eating dirt, paint, ice chips. These are the common things that patients with pica will like to eat. Also, enuresis is a high-yield board review topic. And what is the common scenario a patient presents with? Well, typically board exam questioners want to know when the control of the bladder should occur. And the answer here is 5 years of age. So at 5 years of age, there should be proper bladder control. And there's two types, primary and secondary type of enuresis. In these conditions, what happens is that the management is through proper history and physical, and behavioral treatment is first line, such as looking at things like reward system, charting dryness. Child should void before going to sleep. And also keep in mind that with enuresis, there's a hyposecretion of ADH, and the patient's sleep architecture can be affected as well. So, another strategy that works is to alarm or wake the patient 2 to 3 hours after falling asleep, or patients can have pharmacotherapy such as imipramine, and that's usually the drug of choice on the board exams. But first line on the board exam, go with the psychosocial and behavioral therapy, and then choose imipramine as your answer for pharmacotherapy, along with DDAVP, which is a fast-acting but a more costly medication that can lead to hyponatremia and water intoxication. The secondary type of enuresis will have a presentation after a period of dryness for greater than 6 months. And it's usually caused by psychological factors or urinary tract infection, constipation, diabetes, etc. And to evaluate this, you need to order a urinalysis and treat the underlying condition. Another high-yield board review topic is encopresis. And in this case, patients have a condition where the passage of feces is inappropriate after a chronological age of 4 years. And what happens is that patients can have toilet phobia, early toilet training, aggressive management of constipation, or painful defecation due to fissures as some of the causes for encopresis. The types include retentive encopresis, where the hard stool on rectal examination is needed on documentation, but a negative exam requires a plain abdominal x-ray. And presence of fecal retention is evidence of constipation, and you should treat the underlying constipation. Some patients can also have anal sphincter malfunction. The associations with encopresis on the board exam are with global developmental delays and enuresis, and psychosocial stressors or conduct disorder. Now, the management and treatment of encopresis is to first clear the impacted fecal material and short-term use of mineral oil or laxatives. And it should be only short-term use, not long-term. A high-fiber diet, concomitant behavioral therapy, regular postprandial toilet sitting, as well as individual and group psychotherapy are all useful methods for treatment. So the first line treatment is to clear the impacted fecal material for the board exam, and for diagnosing, the hard stool on rectal examination is sufficient, but if there's a negative stool exam, then you need to get the abdominal x-ray. So the first line is going to be examination, and then the second one is going to be the x-ray. Let's review some common sleep disorders, and let's start with talking about sleepwalking and sleep terrors. This is a condition where patients will have no daytime sleepiness or recall. With nightmares, there is a recall. The sleepwalking and sleep terrors have a common family history, whereas nightmares do not. And the treatment is reassurance and making sure that you avoid excessive sleep deprivation in patients with sleepwalking or sleep terrors. Also, patients usually have this during the slow wave sleep, and patients can be displaced from their bed. Now, the next similar topic is nightmares, which does have a recall and daytime sleepiness. Also, there's a low arousal threshold, and patients usually don't require treatment unless it's persistent and frequent, in which case you should investigate causes such as anxiety disorders. Now, this usually occurs during REM sleep. That was a COMLEX and USMLE instant podcast of sleep disorders, Encopresis, Pica Enuresis. But please visit COMLEXflashcards.com for additional board review lectures, and good luck in your preparation for the boards, and thank you for listening.